Cases of COVID-19 in children have soared in recent weeks, in part because of the highly contagious Delta variant, raising concerns among parents and doctors just as schools are reopening for in-person learning. Dr. Kavita Patel is a primary care physician and NBC News medical contributor. Thanks for joining us today.
Thanks so much, Carolyn, for having me.
Here in California, students are required to wear masks as they return to school, but are there additional steps that parents should be thinking about to protect their children?
Great question. We're all asking that as parents ourselves. Number one, have a conversation with school leadership and your teacher about the ventilation in the classroom. Will the windows be open where possible? LA has great weather. We should take advantage of it. Wherever possible, outdoor classrooms, outdoor lunches, as much possible air exposure. Number two, get to know where you can get your child tested. Some schools are testing, but if not, know where you can have your child tested same day with hopefully a quick turnaround where possible. And then number three, even though we're all being required to wear masks, which is the right thing, make sure your child has a well-fitting, high-quality mask. I know some have recommended kind of medical-grade masks. The best mask is the one your child wears well. So those are 3 easy tips to stay safe.
When children are playing outdoors for recess, should they also be keeping those masks on?
I do think that if children are going to be outdoors but in close contact, so team sports, that it could be useful to keep the mask on until we see, especially in Southern California, if cases continue to rise. But I will tell you, outdoors really is safe. So I would love to see children playing outdoors without a mask if they can be on the swings and do things that make them feel like they're having some playtime. But again, all things should be contextualized with cases. What we want to avoid is having one child unfortunately get sick, and then keep in mind the entire classroom will likely need to be quarantined. And that is something we want to avoid.
Of course. And we've seen COVID infection rates climbing recently among children. Children's hospitals also seeing a spike in medical care needs among their young patients. Do we know if Delta is affecting children differently than we've seen in the past with COVID?
It is, but not maybe as we think. It is affecting children differently because it's much more infectious. A year ago, we thought children weren't really good at getting others infected, especially adults. Delta's changed that. But what we do know is that Delta has not made children sicker than we would expect. And we know that because the percent of children hospitalized, even though it seems large, it's not higher than what we saw a year ago. Now, we have to watch that closely because, as you mentioned, we're seeing more and more children affected every day. But again, that's largely because they're unvaccinated and it's a different variant.
All right. Well, Dr. Patel, thank you again for your time. We appreciate it.